Okay, and the final section of this unit comes from chapter 20 of your textbook, and it's medical emergencies. Here are your section objectives for medical emergencies. So we're going to talk about the different terms, the objectives of first aid. We'll talk about the emergency cart, the crash cart. We'll talk about levels of consciousness, signs and symptoms of medical emergencies, and then how we respond to those appropriately. So what is an emergency? Any situation in which the condition of a patient or a sudden change in medical status requires immediate action. Okay, that's an emergency. It means we have to act immediately. So what are our overall objectives in an emergency or of first aid in general? Number one, preserving life. Okay, so we want our patient to survive. We want to avoid any further harm to the patient. And then we want to obtain appropriate assistance. So we are not going to be the final say in a medical emergency, but what we need to do is we need to be able to recognize the need for assistance, and that's probably the most important thing. And especially as a student, understand that your first and the most important person to get assistance from is going to be the technologist that's supervising you. Okay, so what is some of the necessary equipment for handling medical emergencies? So we need to know the location of each of these items ahead of time, because you don't want to be scrambling around and not knowing where something is when there is an actual emergency. So know where these things are. For the emergency cart, that's more commonly called a crash cart. That contains all the equipment needed to handle life-threatening emergencies. So that's going to have the medications, artificial airways, if the patient needs to be intubated, sphygmomanometers to measure blood pressure, stethoscopes, defibrillator. Now, when we talk about the defibrillator, that may be on the crash cart, or it might be a separate thing that you have to get. But an automated external defibrillator, or an AED, what that's going to do is it's going to analyze the patient's cardiac rhythm and then deliver a shock if needed. So when we talk about defibrillation, what we're talking about is if the patient is in ventricular fibrillation, that's an ineffective kind of fluttering cardiac rhythm. And so that's really what the AED is trying to detect is ventricular fibrillation. And when it does detect that, it may deliver a shock to the patient. And so what you got to make sure of is when the defibrillator is analyzing for the rhythm, you shouldn't be touching the patient at all, okay? Because it's analyzing for the rhythm, and then it's going to tell you whether or not a shock needs to be delivered. And a lot of times there'll be a button that has to be pressed for that. And again, when the shock is delivered, all hands have to be clear from the patient, okay? And then in terms of suction, that's used to maintain an open airway if there's fluid obstructing that. And that consists of a canister, tubing, and a suction tip. So every room should have a suction device within it. That's a necessary emergency equipment as well. All right, so here are just some pictures of these devices. So here's your suction canister with the tubing. Here's your suction tip. This is an AED. And this is your crash cart over here, which also looks like it probably has an AED or a monitor on top of it as well. All right, so I have arranged the serious emergencies a little bit differently than what your textbook has done, just because I'm kind of ordering them in, most life-threatening or most potentially life-threatening at the top to less potentially life-threatening at the bottom. But these are all serious. So for each one, I'll give you a brief description, the signs and symptoms, and then what the appropriate response would be. So what is cardiac arrest? Well, it's the sudden stoppage of cardiac output, or the cessation, the end of heart function. So the heart is no longer working here. So is it the same as a heart attack? No, it's not. A heart attack means that the tissues of the heart muscle are being deprived of oxygen, okay, but the heart is still functioning for the time being. Now, can a heart attack lead to cardiac arrest? Absolutely. But it's not immediately and not always. So what are the signs and symptoms of cardiac arrest? Well, number one is going to be unresponsiveness, no pulse, and no respiration. All right, and then what's going to be our response for cardiac arrest? Well, we're going to do CPR, which stands for cardiopulmonary resuscitation. So how are we going to do this? What's going to be our method? Now, you're all going to do your CPR certification, but we cover this here as well. So first of all, we're going to establish unresponsiveness. Okay, so we're going to shake the patient's shoulders and shout. And then the very next step is we're going to call for help. Okay, so be familiar with the location of the call buttons or the phone numbers at your facility. And again, your first person you're going to get should be your supervising technologist. Okay, and if we, the next thing we're going to do is we're going to check for pulse and respiration. So if we have no pulse and no breathing, and remember, we're going to assess the pulse at the carotid artery. Okay, if we have no pulse if we check for 5 to 10 seconds and we got no pulse and we don't see any breathing, we're going to begin chest compressions. Now, I put an asterisk by that because we need to always be aware of the patient's DNR status. Okay, so if the patient is a DNR, that means that you are not going to do CPR for that patient. You're not going to do compressions. So make sure you know that before you start this. Again, we're going to start our cycle then, okay? So when we do that cycle, we're going to start with chest compressions, okay? And we're going to do that at a rate of 2 breaths per 30 compressions, okay? But the most important thing to understand is the quality of the compressions is probably the most important thing in terms of saving that person's life potentially. So the compressions need to be very quick. So they have to be 100 to 120 compressions per minute. If you kind of hum the song Staying Alive, you can kind of use that as a rhythmic guide to make sure you're going fast enough. So again, like I said, 30 to 2 ratio, compressions to breaths. The breaths will be given either with a bag mask or a pocket mask, which those will be available on the crash cart. And then for infant rescue, to rescue our infant anyways, it's going to be a 15 to 2 ratio of compressions to breaths.